So today we have a further 123 new positive cases of COVID-19, and that brings the total number of confirmed cases here to 513. Sadly, we know another person has tested positive for coronavirus and has died. That's a total of 22 people here in the north and 68 people across the island who've lost their lives. I want to send my sympathy to those families who are bereaved at this time. And I think we all need to take a minute just to think about those people who are bereaved through the disease and what they're going through at this terrible time. Not only are they dealing with the loss of their loved one, but their pain is also compounded by the fact that they're not being able to grieve in the way in which they normally would. We've been hearing some very truly harrowing stories of people who have lost a loved one to coronavirus, who haven't been able to be with them whenever they passed or attend a funeral. This is the sad but painful reality of what we're dealing with. Unfortunately, this is real life for us all now, and the actions in each and every one of us matters. We can't stop this virus, but we're trying to do everything we can to reduce the number of people who will die as a result of COVID-19. And we're trying to reduce the number of families who are having to deal with this horrendous situation. I think to say this, that the Executive's priority is about saving lives. It's about how do we protect our people as best that we can. But there's certainly a different emphasis from different parties in terms of the approach and how we respond to the crisis. You know, I have concerns around protection for staff, for the PPE. I have concerns around the level of testing, that we're not doing enough in terms of community testing. But I continue to make those points in the Executive. I continue to raise those points with the Health Minister and with Executive colleagues, because that's my duty. You know, we're a political leader. Our job is to represent our views. None of us are wallflowers. We are here to make a point. We are here to make a difference, and I'll continue to make those views known. I mean, I would say that the views that I've expressed are shared quite widely across society. They're certainly from the healthcare staff that I speak to in the front line, the domiciliary care workers, the community nurses, people who are actually working in our hospital wards. They don't feel that they have the access to PPE. So it's important that the Health Minister continues to hear those things. I know he hears it directly himself, but I take every opportunity to raise those things. But I want to be very clear, this issue, the issues of where I see that things perhaps in terms of the speed, in terms of testing or PPE getting out to staff, this isn't an orange and green issue. This isn't Dublin versus London. This is very much, it's not even about the DUP versus Sinn Féin. This is about me standing up for the views that I have heard from those people who work on the front line, and I will continue to do that. And I will also continue to work with Executive colleagues. In terms of working with the South, I mean, we live in one island. The virus doesn't stop at a border. It's important that we do have strong relationships. The two CMOs are regularly in contact. The two health ministers are regularly in contact. And then we will have a conversation tomorrow with both the Taoiseach and the Secretary of State, just around furthering that those relationships, both north-south and east-west. So I think those relationships are very, very important.